Hi, I'm Jackie Levin with Leading Edge Nursing, and we're in my Pilates studio today. I'm focusing on back health. I've become increasingly concerned and aware of the vast number of injuries nurses and nursing assistants are experiencing in the course of their work. And I'm bringing you core stability breathing as one method that can strengthen your abdominal muscles, give you a mechanical advantage, and protect your spine. This method uses a natural in-breath, but on the exhale, you're bringing your abdominals deep down into your spine. What this does is it gets all your abdominal muscles to work together and form a corset around your spine, which is what gives you greater strength, stability, and the mechanical advantage. I'm going to share a quick story about how I use this in my nursing practice, and I've used it both in home care, in the hospital, in my private practice, and anywhere where I can see patients. So several years ago, I found the value of this when working with a woman that I was asked to see as a holistic nurse to help her with non-pharmacological pain management. So as I do with all my patients, I ask them, what's distressing you the most today? And her answer had nothing to do with pain. She was desperate to go home, and they wouldn't discharge her until she was able to stand up on her own. I asked her what she was doing currently, and one of the things was her husband was helping her, but he wouldn't be there all the time when she was home. And the other thing she was using while in the hospital was her IV pole. I asked her to show me. So with her frail little arm and her frail little body, she grabbed a hold of the IV pole and struggled with all her might to stand up. So I told her as friendly as I could that last I knew, we don't use our arms to stand up. We use our legs, and that I would show her a way of using her abdominal muscles and her breathing to give her an extra advantage. So how this works is, as I said, use a natural inhale. We say inhale to prepare, exhale to do the movement. So if you want to help someone who is laying down and you're going to help them sit up, or you're going to help them turn from side to side, both you and the person you're working with would simultaneously do the method. And you would ask them to inhale to prepare and then exhale as they go from laying to sitting. Same thing from sitting to standing. Inhale to prepare. Exhale, draw the stomach muscles deep into your spine to do the movement. And when I showed this to the woman in the hospital, just like that, she could go from sitting to standing on her own. How you can practice this to get greater and stronger abdominal muscles is breathe like this 10 times a day, twice a day, every day. And you can give yourself a little bit of feedback by standing against a wall or your back against a chair or flat on the floor or a bed, and placing one hand in front of you and one hand behind you. When you inhale, naturally your belly gets a little bigger. And then when you exhale, you draw your stomach muscles away from the front hand and into the back hand. And when you do that, you should feel, if you're doing it correctly, that your spinal muscles are now pressing your hand further into the wall or the surface that you're on. I hope you enjoy these tips and share them with others so that they can also get a better mechanical advantage and protect their spine when working with others. And you can subscribe to my newsletters by going to my website at www.leadingedgenursing.com. Thanks for all you do every day in caring for others and for caring for yourself.